Hello, my name is Carlos Dominguez and I will be showing you how to measure blood pressure. Patients should refrain from any caffeine and nicotine ingestion for at least 30 minutes prior to the test. Patients should be seated quietly for at least 5 minutes prior to checking the blood pressure. Feet should be flat on the floor without being crossed, their back supported by the chair, and their left arm should be placed at heart level. Next is a blood pressure cuff. This is what is placed around the patient's arms. The correct cuff size must be used, and to be able to ensure this, there are markings on the cuff to show whether a small or large cuff is needed. Next is properly placing the cuff. There is a line marking on the cuff indicating that it is to be placed on the patient's brachial artery. Before placing the cuff around the upper arm, you should palpate the arm for the brachial artery. Then proceed with putting the cuff on with the marking placed correctly. The cuff should be firmly wrapped around the patient's bare upper arm 2 to 3 centimeters above the antecubital fossa, which should be at vertical height of the heart. The bladder within the cuff should encircle at least 80% of the patient's upper arm. Before pumping air into the cuff, make sure to turn the valve all the way towards the right, but not too tight, making it difficult loosening it up. And the calibrated manometer gauge can be placed either on the cuff or anywhere that you can easily see the readings. Next is the stethoscope. The two earpieces are called prongs, and they should be pointing outwards, away from you when placed in the ears. If they are pointing inwards, you will not be able to hear the correct sounds. Make sure the diaphragm is on by turning it and tapping it lightly so you can hear it. The diaphragm is then placed over the brachial artery with little pressure, as applying too much pressure will affect the sounds you hear. The cuff pressure should be quickly inflated to 200 millimeters of mercury if blood pressure is unknown, or to just 20 millimeters of mercury above the first correct sound if blood pressure is known. The cuff pressure should be released at about 2 to 5 millimeters of mercury per second. Correct sounds are blood flow sounds observed while taking blood pressure. You will be listening for a thump noise, and whichever reading the first noise was heard at will be your patient's systolic pressure. The systolic blood pressure is the point at which the first correct sound is heard. At the diastolic blood pressure, it is the point before the disappearance of correct sounds. Wherever that last thump was will be your patient's diastolic blood pressure. Make sure to always write down the readings in even numbers. At least 2 measurements should be taken at minimum of 3 minutes apart, and the average of the two should be taken. Make sure to remove the cuff from the patient between measurements.